Did you know that the federal government reopened a special enrollment period on healthcare.gov? It's open now through May 15th, and it's a great opportunity for people without health coverage to sign up. Our next guest is here from Blue Cross and Blue Shield to talk about how you can get covered. Please welcome back Mike Bertaut.
Hey, Malik, and I'm glad everybody could join us today to talk about this really important topic in our healthcare.
Yeah, it's really cool that they have reopened this. Tell me a little bit more about this special enrollment period. What
Yeah.
makes it so special?
Well, historically, if you take a look at the ACA, wide open enrollment like we're having right now is actually pretty rare. It only happens for about 6 or 7 weeks in a given calendar year. This month, the new administration coming in said these are not normal times. Let's go ahead and have a 90-day wide open enrollment period to sign up for health insurance for anybody under 65 who doesn't get good coverage at work. And so the healthcare.gov website is wide open right now.
Which is great because that's true. With so many people out of work right now, so many people knowing that there is a virus out there, we need to make sure we are covered. So, for people out there who are watching right now who want to know if I qualify for this special coverage, how do we find out if we qualify for it?
Well, if you check with your HR department, if you're employed and you're getting coverage through work, the odds are that's going to be your best bet, taking your employer's deal. But if you've been furloughed or your hours roll back or you've been laid off and you lost access to that affordable employer coverage, or if you just never had coverage before, this is a golden opportunity to make that go. We had almost 400,000 people the last time I checked living in Louisiana who did not have health insurance coverage. And they can get access to this healthcare.gov site. The federal government is literally pouring money onto these premiums to help people buy coverage.
Very interesting. So, when people go on healthcare.gov, what is some of the information you need? We actually have some information for everyone. You obviously need your name. What is some other information you need?
Just the basics: your legal name, your address, your phone number, your email address, and your social security number. That's it. They don't need to know anything about your health conditions or what medicines you're on. None of that stuff matters when it comes to qualifying for a policy on healthcare.gov.
And what's cool about when you go on healthcare.gov to see if you qualify for this special coverage, you also can see if you qualify for Medicaid and Medicare, right?
Yeah, if you can imagine every family in Louisiana being arranged in order of their income, from the lowest income all the way to the highest, anybody in a very big zone can get qualified through healthcare.gov. If you're eligible for Medicaid, they'll let you know and they'll direct you to the Department of Health website. If you're eligible for federal assistance to buy your own private insurance, they will tell you exactly how much you qualify for and exactly how much money you're going to get to help pay your premiums.
And remember, with Medicaid, it's for people with lower incomes. For
Yeah.
Medicare, people who are 65 and older. But a lot of people may not have health care, and not only because they're not employed, but they just can't afford it. What about costs? Can people get help getting this plan paid if they qualify for this special coverage?
I don't want to talk about federal poverty lines and all those percentages. It gets confusing. But all you need to do is go on healthcare.gov or use one of the contact lines we give you and give them an estimate of how much money you're going to make this year, just an estimate, and they'll tell you how much money you qualify for. A family of four can get financial assistance all the way up to about $95,000 to $100,000 a year of income. So we're talking about a broad swath of the people who live in Louisiana.
Unbelievable. Please go to that website, healthcare.gov, if you think you qualify for this. Now, since we have Mike here, I asked you last time about the COVID-19 vaccine. What's the update on that? Is it true that it's $0 cost if we want to get the vaccine?
Yes, yes. The federal government has bought every dose of vaccine that's going to be distributed in the United States this year has already been paid for by Washington. The person administering it to you, whether it's at a clinic or at a drugstore, they're going to get paid to administer it by either Medicaid, Medicare, the government, or your health insurance company. Don't panic. If they ask you for your health insurance information, they're not doing that so they can charge you money. They're doing that so that they can get paid by your carrier to administer the vaccine.
It's important to keep the conversation going with your healthcare provider because vaccines, they're rolling out. And if you want to get it, it may cost you $0, which is great.
Zero.
Now, remember, everyone, this special coverage plan is happening now and it goes all the way until May 15th. Mike, thank you so much for being here. And if you want more information about everything going on at Blue Cross Blue Shield, check out planoptions.com or give them a call at 1-844 Get Blue or follow Blue Cross and Blue Shield of Louisiana on social media at BCBSLA.